In DSM-5, we've made 3 major changes to autism from DSM-4. The first of these is a merging of the independent diagnoses of autistic disorder, Asperger disorder, and pervasive developmental disorder into a single spectrum disorder, autism spectrum disorder. Within that, we have eliminated childhood disintegrative disorder on the basis of it was not being used as a diagnosis, and more importantly, we've added a specifier age and onset, which allows a clinician to diagnose autism spectrum disorder with a later age and onset, typically after 3 years of age. The second major change in autism is the move from 3 criteria to 2, and this was done by combining the social and the communication criteria of DSM-4 into a single social communication or social reciprocity, which is the main feature of autistic spectrum disorder. Within autism spectrum disorder, the social communication deficits are impairing and lifelong persistent. The second criterion is restricted repetitive behaviors, and in that one, some patients actually, through training or developmental progress, may have less obvious manifestations of the RRBs during adolescence and adulthood, so that criterion can be met on the basis of history alone. The third major change to the autistic disorders I've already mentioned, and that's the inclusion of a number of specifiers. We expect clinicians to assign a primary diagnosis of autism spectrum disorder, but then to provide a very rich degree of information about that individual patient's onset and clinical course by the use of descriptors for age at onset, type of onset, were their skills lost or not, is intellectual impairment present, is verbal impairment present, as well as what kind of disorders are associated. As we know, autism spectrum disorder is frequently comorbid with intellectual disability, but it's also frequently comorbid with anxiety disorders, ADHD, and in the medical realm, epilepsy. The work group has given a lot of consideration to the question of what will the impact of the recommended changes be. Probably the most important question has been, is there going to be a change in prevalence as a direct result of the change in criteria? We frankly expect that it will not change much. The criteria being used in DSM-5 are basically the same as those of DSM-4. They have been modified to be much more descriptive of individual patients and to more accurately reflect the range of symptom severity. However, we have not included new patient groups or excluded any of the patient groups. The second question has been, how is this going to impact research going forward? And to be honest on this one, again, the changes are minimal, in that the field had already moved to using a single autism spectrum disorder, with over 95% of the publications in the last 5 years using ASD rather than the individual diagnoses of autism, Asperger disorder, or PDD-NOS.